you read about a trauma, a sudden trauma, and you read that parents say, oh, well, you sort of leave your body. And I have to say that that truly is how I felt. I immediately rushed out into the street, and Wheezy was obviously had been struck. Her brain had suffered a very extensive brain bleed. She had fractures around her eye and a hip fracture.
It's the #1 killer of kids, trauma. Whether on the playground, the field, or on the road, when a child is injured, the stakes are high.
Children are different anatomically and physiologically than adults are. They are different in each of their age groups. It requires a set of knowledge of very small, very medium, very large to understand how to take care of kids. There's an overlay of a lot of psychological things that are managing kids, and most paramedics, most physicians, most emergency physicians, most surgeons, most nurses don't know as much about taking care of kids as they know about taking care of everything else.
When I came out of the convention center, the ambulance was just pulling up. In the rush of the moment, I said, where are we going? Where are you going to take her? And they said, we are going to take her to level 1 pediatric trauma center. And it was so reassuring to just hear that and know that where we were going we were going to receive outstanding care. One of the classic concepts in trauma care in all age groups is the concept of the golden hour. Time matters. So we think of wanting to get an injured patient to definitive care within the first hour of their injury, and the clock is ticking. It's as important or more important in children than in other age groups, but it is absolutely important in children.
I'm Wheezy Broughton, and I'm in 5th grade, and I'm 11 years old. I was out of school for about 3 months, and then I started going back for half days. So I'd go from 8 o'clock to 12 and go home, because my brain couldn't take that long of learning and reading and stuff. And I still have headaches, I'll have eye pains and stuff and hip pains, but they've gotten a lot better.
Wheezy's a wonderful kid and had a really serious injury. And a big part of her being able to survive was the type of care and the timeliness of care that she got.
75 million children live in the U.S. About 1 in 5 do not have access to a trauma center within the first hour of injury, the golden hour. So a lot of the work that we do at the Childress Institute for Pediatric Trauma is to assist those hospitals that are helping those kids that are not necessarily trauma certified, but they have to be ready to take care of the child. We are not clinical, we're an institute, so we focus in research and education. And so we assemble and disseminate nationwide and globally what are, again, best practices in treatment, particularly for severely injured children.
For severely injured patients, the chances of surviving is 25% better if the patient gets to a trauma center and treated there than if they're treated in a non-trauma center hospital. That is a very big difference in improvement in survival.
Pediatric trauma is very personal for me. In 2008, our 15-year-old son Matthew died of a traumatic brain injury playing high school football. So, our passion, my wife's passion, our family's passion to, number one, not let that happen, but really number two, if your child is severely injured, have the child cared for by the best hospital, the best practitioners. It's now my mission.
I was about 15, and I was going into my sophomore year in high school, and I was riding with one of my friends. We were riding a horse around my neighborhood, and the horse got spooked by a car. And I held on, from what I've been told, for a very long time, but eventually I got knocked off and my head hit the concrete.
At the time, no one knew the extent of the injuries, except I think the EMS had a clue, because they said, where do you want to go? And we live in a county that we're not required to go to a certain hospital. And I said, I don't know, where do you go? And he said, if it was my daughter, we'd go to a level 1 pediatric trauma center. We got there, and they basically said her only chance to survive is to do this very serious surgery to remove her forehead so her brain could swell out. And I said, well, what's our choices? He said, that's the choice. So what do you say to that? That's what we're going to do. I strongly support the work Childress Institute is doing. I feel like that the research that the Childress Institute has done has given me Meredith, has given Meredith back to our family.
I'm hoping everyone who can will support the Childress Institute for Pediatric Trauma. It is such a massive problem that without some societal support to push for the creation of new knowledge, the dissemination of the knowledge that we have, and the training of people to take care of injured kids, there are a lot of lives we can save today by doing that.
The Childress Institute for Pediatric Trauma helps save the lives of injured kids. To learn more, visit saveinjuredkids.org.